Hi, I'm Joseph Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk about gum recession, and I want to talk about a new treatment for gum recession. To the best of my knowledge, at this time I am the only periodontist in Michigan who is qualified to do the Dr. Chow pinhole surgical technique. It's a breakthrough in treating gingival recession. Typically, when we treat gingival recession, we have to take tissue from the roof of the mouth, or we take cadaver donor tissue. We lift up the gum and we put this tissue under the gum, close the gum up over it to get some thicker, healthy gum tissue. And these procedures usually work quite well, but sometimes they can be a little bit uncomfortable or a little bit more invasive than is necessary. And this new technique, the pinhole surgical technique, is really a wonderful new technique. It's minimally invasive, requires no incisions typically, requires no sutures typically, requires no downtime on the patient's part typically. So it's really a breakthrough. And what we do is we take a pin, actually a needle, and we make a small hole in the gum tissue through which we then using special instruments, we loosen that gum tissue so that it's loose enough so that we can actually move it, reposition that gum tissue and move it down over the receded areas. We take another material and then put it into that pinhole. This material dissolves over time to kind of hold the gum tissue in place. The patient then leaves, usually no sutures, no incisions, little discomfort, usually no downtime, and the tissue is covered beautifully, works very well, it's minimally invasive, and we've been very happy with this procedure. So if you have gum recession and you're looking for, and you perhaps heard that these other procedures may be a bit uncomfortable, you may be a candidate for the pinhole technique. Not everyone is. Some areas of recession need to be treated more traditionally, but many can be handled with this minimally invasive pinhole technique. So if you're interested, come on in and we'd be happy to tell you more about it.